citing references that don't even exist. That's lying and dishonest, sir. My concern here is that you and this administration are undertaking vast changes to our federal public health system and using purported facts and gold standard evidence that you claim to have as justifications for your decisions, actions, and frankly, your decimation of our nation's public health infrastructure. Yet, what you are relying upon isn't real. It isn't data-driven, and it isn't based in fact, science, or reality, sir. It's wrong. As the secretary of one of the most consequential departments within our federal government, mischaracterizing data is not just some typos in a report that gets put on a shelf. Instead, your words and your words of your department carry significant weight. Do you agree?
A tense exchange unfolded on Capitol Hill when Representative Raul Ruiz of California confronted Health and Human Services Secretary Robert F. Kennedy, Jr. over the credibility of a high-profile report tied to the administration's Make America Healthy Again initiative. Before we get into the details, be sure to subscribe to the channel. These hearings shape national health policy, and subscribing helps you stay informed beyond the headlines and viral clips.
Thank you, Mr. Chairman. Earlier, Secretary Kennedy, you said you wanted to instill trust using truth, evidence-based, gold standard science. But Mr. Kennedy, in late May, the so-called, quote, Presidential Commission to Make America Healthy Again released what HHS described as a, quote, groundbreaking assessment that purported to identify the key drivers behind childhood chronic disease. Improving the health of America's children is a goal I share, and I recognize this is a passion of yours, Mr. Secretary. That is why I was struck to learn that the report was riddled with mistakes, misconstruing and intentionally or not misstating key references, data, and evidence that either do not exist or are not accurately reflected in the report. When journalists reached out to many of the authors of the studies included in the MAHA assessment, numerous researchers and academics stated that they never wrote the papers as cited, or the papers cited didn't even exist altogether. Mr. Chairman, I want to submit these 3 news reports on these miscited documents from notice from May 29th and May 30th.
Without objection.
Ms. Secretary Kennedy, you're listed as the chair of the commission. Did you read the report and fact-checked its sources prior to publication?
All of the factual...
Did you read the reports, and did you yourself fact-check them, sir?
I did not fact-check.
You did not fact-check. So why then, as has
all of the
widely reported... Excuse me, sir, I'm
that,
speaking. Why then did the report include a citation to sources that don't even exist? How does that happen under your leadership, sir?
All of the foundational assertions in that report are accurate.
They did not exist. How can they be accurate if they did not exist, sir?
Some of the citations
You know, in fact, my understanding is that even once the report was updated, more authors and researchers came forward stating that their research was misconstrued. This is quite unbelievable, sir. In fact, I was a pre-med at UCLA. They have a great pre-med program. If somebody turned this in as an undergrad to their professor at UCLA, they would have received an F, sir, an F for the misinterpretation, the falsehoods, the denials, and also citing references that don't even exist. That's lying and dishonest, sir. My concern here is that you and this administration are undertaking vast changes to our federal public health system and using purported facts and gold standard evidence that you claim to have as justifications for your decisions, actions, and frankly, your decimation of our nation's public health infrastructure. Yet, what you are relying upon isn't real. It isn't data-driven. And it isn't based in fact, science, or reality, sir. It's wrong. As the secretary of one of the most consequential departments within our federal government, mischaracterizing data is not just some typos in a report that gets put on a shelf. Instead, your words and your words of your department carry significant weight. Do you agree?
The citations in that report were wrong. That was a mistake. They were corrected within 24 hours.
Yeah, but there were wrong still even after that, and they're wrong still today.
There were no
So do you believe that your words carry significant weight?
There were no erroneous.
Do you believe your words carry significant weight?
There were no erroneous factual concerns.
Do you believe that the Secretary of the Department of Health and Human Services plays an important role in upholding scientific integrity?
Yes.
Okay, so then, in fact, what is most striking about this is that you've also threatened to bar governmental scientists and researchers from publishing in top medical journals. You've barred them from publishing in top reputable medical journals and instead proposed, quote, creating our own journals in-house. The idea that we would limit the ability for federal researchers to publish in the most preeminent medical journals and instead have HHS just publish more reports like their MAHA failed assessment, lacking the scientific rigor, accuracy, or peer-reviewed criteria that are required by leading journals should worry us all for the future of medicine and innovation. Sir, you mentioned that building trust was a priority number 7. You have failed already in building that trust. How can we trust you when in your report, under your leadership, when you're the chair of this report, has false information and makes up research that didn't even exist? So, Chairman,
you left me no time
yield
to answer
back
the question.
the remainder of my time.
Gentleman yields. The chair now recognizes.
Ruiz, a physician himself, opened by referencing Kennedy's stated goal of rebuilding public trust through truth, evidence-based medicine, and what Kennedy has often described as gold standard science. Ruiz made clear that improving children's health is a goal he shares and acknowledged that childhood chronic disease is an issue Kennedy has long emphasized. But Ruiz said he was alarmed by what followed. In late May, a presidential commission chaired by Kennedy released what HHS described as a groundbreaking assessment identifying the drivers of childhood chronic disease. Soon after its release, journalists and researchers began examining the report's citations. According to multiple news outlets, they found serious problems. Ruiz explained that numerous studies cited in the report were either misrepresented, incorrectly attributed, or in some cases did not exist at all. Several researchers whose work was cited publicly stated they did not author the papers as described or that their findings were misconstrued. Ruiz entered multiple news reports into the congressional record documenting those errors. Subscribe now if you want clear explanations of how government reports are vetted and why scientific accuracy matters. Ruiz then asked a direct question. As chair of the commission, did Secretary Kennedy read the report and personally fact-check its sources before publication? Kennedy acknowledged that he did not fact-check the report himself. That admission became a turning point. Ruiz pressed further, asking how a document released under Kennedy's leadership could include citations to sources that did not exist. Kennedy responded by asserting that the report's foundational claims were accurate, even if citation errors occurred. Ruiz pushed back, pointing out that claims cannot be verified if the underlying sources are fabricated or misrepresented. Ruiz noted that even after corrections were made, additional researchers continued to come forward, saying their work had been distorted. He compared the report to a failed undergraduate paper, saying it would not meet basic academic standards due to misinterpretation, false claims, and non-existent references. Subscribe to the channel if you want continued coverage on scientific integrity in federal policymaking. The heart of Ruiz's argument was not about typos or formatting. He warned that the administration is pursuing major changes to the nation's public health infrastructure while relying on what he described as unreliable and unverified evidence. In his view, that poses serious risks to evidence-based decision-making at HHS. Ruiz emphasized that statements issued by the Secretary of Health and Human Services carry enormous weight. Policies shaped by flawed data can affect vaccine policy, nutrition guidelines, disease prevention strategies, and public trust in medicine itself. Kennedy acknowledged that some citations were incorrect and said those errors were corrected within 24 hours. Ruiz countered that inaccuracies remained even after revisions and argued that the damage to credibility had already been done. The exchange escalated when Ruiz raised concerns about Kennedy's public statements regarding scientific publishing. Ruiz accused Kennedy of threatening to block government scientists from publishing in leading medical journals and instead proposing that HHS create its own in-house publications. Ruiz warned that limiting researchers' access to established peer-reviewed journals would undermine scientific rigor, transparency, and innovation. He argued that replacing peer review with internal reports similar to the MAHA assessment should concern anyone who values medical progress. Subscribe if you want deeper analysis of how science policy decisions affect medicine and research nationwide. Ruiz concluded by returning to Kennedy's stated priority of rebuilding trust. He said trust cannot be restored when reports under Kennedy's leadership contain false information and cite research that does not exist. Ruiz yielded back his time after delivering a blunt warning about the consequences of undermining scientific integrity at the federal level.